Hey folks, this is Dr. Casey Ashby here at Adult and Pediatric Ear, Nose, and Throat in Kalamazoo, Michigan. Today is Friday, and this is the last day of the week and the last day that I am going to be here in the office for another 2 weeks. So next week, Dr. Berry will be here in the office. The week after that, Dr. Shapiro will be here. We're still social distancing, limiting our number of patients here in the office. So hopefully we're getting over that curve, and hopefully things will be getting back to normal or some resemblance of normal within the near future. But as for now, we're going to continue to bring you some of these informational videos. Today, I'm going to talk to you about epistaxis. Epistaxis is the fancy medical term for nosebleeds. Nosebleeds are an extremely common issue that we deal with. We see lots and lots of patients with nosebleeds. It's very, very common. We see people all the way from the age of 3 and 4 all the way up to 105 with nosebleeds. So it's not necessarily an age-related issue. Most of the time when people come to see us for nosebleeds, they've had repeated nosebleeds off and on. Oftentimes it kind of comes and it goes. Usually they will stop on their own. Every once in a while we'll have patients who have had such a severe nosebleed that then they end up in the emergency department, and then they end up seeing us on a more urgent or emergent basis. Very rarely we've actually got to go into the hospital to take care of a nosebleed. So how does a nosebleed happen? Where does it start? Most of the time when somebody is having a nosebleed, it is coming from the wall on the inside of the nose. That's called the septum. You've probably heard the term deviated septum. Well, that's the structure in the middle of the nose. It's made out of cartilage and bone. It goes all the way from the front of the nose all the way to the back. And it's lined in what we call mucosa, very similar to the lining on the inside of your cheek. It makes snot, it makes mucus. But this tissue near the inside of the nose, right on the inside there, right about there, sometimes it can be kind of thin. Sometimes the blood vessels, those little veins, can be very close to the surface. If those little veins are really close to the surface, it doesn't take a whole lot to get them to pop open and start bleeding. If the nose is dry, if it's irritated, if it gets cracked, it can bleed. And if you've ever had a nosebleed, you know that the nose can bleed quite a bit. So that's usually where nosebleeds come from. And because of that, the very first thing that you do if you start to have a nosebleed is pinch and hold, okay? So somehow this has been spread throughout the world, throughout the internet, to everybody's aunt and uncle, that to control a nosebleed, you pinch up here and tip your head back. I'm here to tell you today that does absolutely nothing, okay? Very first thing to do if you have a nosebleed is you pinch and hold right here and gently tip your head forward a little bit. What that does is, if that blood vessel is right there, right on the septum on the inside, you're effectively putting pressure on that blood vessel. This is basic first aid. If you cut your hand and it starts bleeding, what do? You hold pressure on it and you push on it until your body can form a clot and can get the bleeding to stop on its own. Okay, so that's the very first thing you do. You pinch and hold, and don't pinch and check, pinch and check. Pinch and hold it for a few minutes, okay? 3, 4, 5 minutes. If you're one of our many patients who takes a blood thinner, aspirin, Plavix, Coumadin, Effient, all these blood thinners that people take. If you're taking one of those, you may have to hold the nose for longer. Give it a good pinch and hold, 10, 15 minutes if need be. Now, if you are doing that and it doesn't stop, usually the next thing that I'll recommend, you take a small piece of cotton. You can actually unroll the cotton. You can take Afrin nasal spray, okay? Afrin nasal spray, I typically recommend people try and stay away from because it's very addictive stuff. But it's sold over the counter. It's a vasoconstrictor. What that means is it takes those blood vessels, those little veins, and shrinks them down. If those little veins shrink down, then they're going to be able to clot more easily. So you soak the cotton with the Afrin, wring it out, put it on the inside of the nose, and again, pinch and hold, okay? Hopefully that's enough to keep you out of the emergency department. All right, what do you do then? You can leave that Afrin in for a few hours and then remove it. You don't want to leave that in for days and days and days, okay? Most important thing as far as taking care of nosebleeds is preventing nosebleeds in the first place. What does that mean? What that means is, especially in the winter, you want some humidity. Get a humidifier, put it by the bedside, put it next to your chair, put a little extra moisture into the air. Keep the inside of the nose moisturized. You can use a saline spray. That's just a simple saltwater spray, a couple squirts up the nose a few times a day. You're not going to overdose on it. You can do that as much as you want. There's also some products that you can purchase over the counter. There's a saline gel or a saline jelly. There's something called Air Gel, AYR. And it's essentially kind of like a little aloe vera product. You take a pea-sized amount on your finger, put it up in the nose, pinch it gently. That's going to help spread around the inside of the nose, keep things moisturized. I usually recommend you do that probably at bedtime. You can do it throughout the day. If your nose is dry, you can do it any time of day. But that's great for kids as well. Oftentimes, if we treat the dryness, treat the irritation in the nose, oftentimes kids won't end up needing to have anything else done. Little kids, make sure their fingernails are trimmed, okay? Kids are notorious for picking, scratching. What happens if you irritate an area? You get a little scab there. Kids don't like that. Adults don't like it. They pick it off, it starts bleeding, and then you just got this cycle that persists. So little kids, cut their fingernails. Okay. Now, if kids end up here in my office or adults end up here in my office, typically what I'll do a thorough examination. I'll take a look inside there. Usually I'll identify the site of the bleeding. Like I said, usually it's on the septum, but it can be other areas as well. Sometimes it's on the outside part of the nose. Very rarely we will see people with what we call a posterior nosebleed. That means in the back. Believe it or not, if I could take my finger and shrink it down to the size of a tiny little cotton swab, I could stick my finger in my nose all the way to the back there. There's some rather large core blood vessels back there. If those pop open and bleed, then we're dealing with a pretty serious nosebleed. Those are generally the ones that end up in the emergency department and may end up with a more serious scenario, a nasal packing or something even more than that. Okay, back to the office. If you're here in the office, I'll take a look. If I see something that looks like it's probably the source of bleeding, what I'll do is I'll numb that area with a little topical anesthetic, and then typically I'll use something called silver nitrate. That's a chemical cautery, looks like a matchstick about this long. I touch it to that blood vessel, cause it to clamp down, scar shut, hopefully to never bleed again. That being said, they can grow back. They may need to be done again later on. For most people, that takes care of it. Now, what about these more complicated issues? Some people that end up in the emergency department. If you are having really serious nosebleeds, it may require a pack in the nose. A pack is essentially a device, a sponge of some sort. They can be anywhere from a couple centimeters up to 6-7 centimeters. It may have to be inserted all the way in the nose. They've got some that are inflatable, puts a little pressure inside the nose. Hopefully that takes care of it. Typically, if it ends up like that, usually it's going to stay in for about 48 hours or so, sometimes a little longer. If patients are on blood thinners, they're usually going to end up in my office to have it removed. Then I'll do a thorough examination, see if I can see where it was coming from, and see if there's anything that needs to be cauterized. Again, after that, moisturization, humidification, keeping any irritation away from there. There are a couple things that can predispose people to nosebleeds. Again, being on a blood thinner can make nosebleeds last longer and more difficult to control. So people who have maybe heart disease, who are on a blood thinner, we are going to be more likely to have more difficult blood thinners or nosebleeds. Unfortunately, there are some people that are just repeat customers. They've had so many problems, recurring nosebleeds. Another thing that's important to take care of is blood pressure. Believe it or not, if blood pressure is way, way high, that's going to increase the pressure in the blood vessels and increase risk and severity of bleeding. In very rare scenarios, if somebody's in the emergency department, they're having a severe nosebleed, they've got one side of the nose packed, then it starts coming out the other side, they get that side of the nose packed. If it is still bleeding and they're not able to get it stopped in the emergency department, or if I'm not able to get it stopped, sometimes we'll actually send those people to see what's called an interventional neuroradiologist. What they can do, they can snake a little coil all the way up into the blood vessel of the nose and put a little pellet in there. That little pellet will effectively occlude or block that blood vessel in order to get the bleeding to stop. That's really kind of a last resort. does come with some associated risks, but again, the vast majority of our patients don't end up getting that done. So I think that's, for the most part, most of what we need to talk to you about nosebleeds. Again, it's important, especially for pediatricians, anybody who's dealing with a kid who's having recurring nosebleeds, easy bruising. If it's an older female, we need to ask about significantly heavy periods. It may be worthwhile doing some blood tests to make sure there's not some sort of bleeding disorder. It's important to get that history from the family if there's a bleeding disorder in the family, so that we can identify that early on. Anyhow, folks, that's about what I have for nosebleeds today. Again, most important thing, do not pinch up here. That does 0. Pitch down here, pitch it, hold. That's all I got, folks. Stay safe. Have a great weekend. If you have any questions, comments, concerns, suggestions for other videos, leave them down below in the comments. If you are so inclined, please feel free to like this video and subscribe to our channel. We're again trying to put out some interesting content. I don't know how interesting it is listening to a doctor sit here in front of his fish tank and talk, but at least it's somewhat educational. Feel free to show your kids. So if there's nothing else, have a great weekend. Thanks for watching.